Behind the Mask, the podcast. Behind the Mask. Behind the Mask. With Dr. William, the OG genius. Behind the Mask, mask. Dr. William. The more you know, the better you do.
It's a good intro.
It is.
Behind the Mask,
I
the
love it.
podcast.
Great song. We need some choreography to it, I think, to open every episode.
No, I think we're good without the
I don't
choreography.
know. Maybe it's something we'll revisit later.
Okay, we'll put that on the list.
Hey, guys. Welcome to Behind the Mask, the podcast. A podcast with the goal of teaching you everything you need to know before having plastic surgery. So it's educational, but of course, we're going to make it fun. And I'm your host, Gabby Allen. We're here in Miami with the one, the only, Dr. William.
Hey,
Hi, Dr.
Gabby, how are
William.
you?
I'm great. Loving this sparkling water you got for me.
Oh, yeah.
Waiting
That's
on
your
my
first introduction.
Delicious coffee.
It's going to be good.
Yeah, I'm excited. Well, to let you guys know, Dr. William here is a board-certified plastic surgeon, the creator of the OG method. And if you don't know what that is, don't worry because we're going to tell you all about it. And Dr. William and I, we met not that long ago, actually.
Yes.
Here in South Florida. I am also the arena host for the Florida Panthers. We're both big hockey fans, and that's
Yes.
actually how we came to know each other.
Yeah, I mean, I have Canadian roots, so I grew up playing hockey and loving hockey since I was a little kid. And I saw Gabby on the screen on the television during the Florida Panthers games. I go to as many games as I can with my family. And you just lit up the screen. You were awesome. I'm like, that is a perfect podcast host. And you loved
Thank you.
hockey,
I do.
which really
Gift of Gab.
that was the that was the tipping point for me. So no. Well, who are you, Gabby? You grew up here though, right?
I am South Florida native, born and raised, my whole life. And actually didn't get into loving hockey until after college. I graduated from the University of Miami, auditioned for their energy team. So I was a dancer and part of their ice crew. So I was on the ice, skating, scraping the ice. And then from there, I grew into this role, which I absolutely love. And timing worked out great. Clinched that playoff spot, number 1 or 2, I guess, right now in the league. So not a bad spot. And I'm here with Dr. William to learn along with all of you. I myself have never had plastic surgery. A lot of this is new for me. So we'll be learning together and we'll be answering all the questions that you have because the more you know, the better you look.
So you're kind of breaking stereotypes with loving hockey and don't know anything about plastic surgery.
I know.
Yeah.
One of a kind.
Yeah.
How do they, and in South Florida of all places.
Exactly. Yeah, in
Yeah.
Miami. So I'm excited to be here because I think it's going to be fun. Obviously, like one of my main points and mandates is about education and talking about plastic surgery, and I try to do it in just a real straightforward way. There's always been so much marketing in plastic surgery that I think sometimes just some of the real things get overlooked. Like I trained as a general surgeon as well, before I did my plastic surgery fellowship. That was kind of what was more common back in those days. And, as a general surgeon, we take out gallbladders, appendix, colon cancer, all these types of things. And you never really see a general surgeon talking on a bill or talking on video or on a podcast or on a billboard or something like marketing. Hey, get your appendix done with me. But you really see that a lot with plastic surgery, with billboards and beautiful women advertising breast augmentations and, these types of things. So it's a very different specialty compared to most medical practices. But I think sometimes, we forget we're doctors. I mean, we went into medical school with goals of helping people and influencing people's health and impacting patients. And so, that's the way I like to practice and kind of move past some of the marketing stuff and really explain to people what are realistic expectations, because there are some people that look just absolutely amazing after plastic surgery. It's kind of even hard to believe. And then there are other people that it's more challenging just with their underlying body structure. And, I don't want those patients kind of thinking that they may look like the other spectacular patients. And so I like to be realistic in that type of thing. So
No, that's fair. And having those realistic expectations.
Yeah.
And like I said, guys, I myself have never had plastic surgery. So it was really interesting when you guys reached out to me, how do I connect with that? And so
And I think it's perfect because I mean, it's great to talk to you because you're
you.
coming at it. We're coming at it from, somebody who doesn't have a lot of preconceived notions and good questions, and just with all of our discussions beforehand off camera. I mean, you just ask good, intelligent, smart questions for things that you don't understand, and that's great. Rather than having somebody coming in with a lot of preconceived notions. So.
Well, I'll be honest, too,
good.
a lot of my any preconceived notions I have were, based off of Dr. 90210 and watching Botched. And a lot of those things, there's so many stigmas attached to plastic surgery.
Yeah.
So, we're here to get the right information to you guys. And things that we're learning together.
Yeah, I mean, a lot of those shows, too, I mean, they're made more dramatic for entertainment purposes and things like that. And that has not, I would say, helped us as a plastic surgery community in terms of trying to get people realistic expectations. But, I want to talk about a whole bunch of things this season and just kind of give like an overview. Obviously one of the really popular procedures right now is BBL, and it's a popular procedure in terms of what I do.
And what is a BBL?
So what is a BBL? So that's perfect. I mean, a BBL is a Brazilian butt lift. In fact, it's kind of named a little bit wrong, I would say, because we're really not lifting the butt. We're augmenting the butt just like a breast augmentation. Oh. So we're making it bigger and reshaping it. So one of my main focuses is really on the shape. Volume is important, but I think shape is, for me anyway, more important to do that. And so that's, we're going to go through... I want to do like really honest, nitty-gritty things where we're going to be complete, comprehensive. I always say I really don't have any short answers to any questions. So, but this format will, allow me to do that and really explain things in detail. I want to go over things about, how to prepare for a BBL, what is a BBL, go through all of the steps needed to get ready, including, how to talk to your caregivers, what are their expectations, and what medications to take, what medications to stop, all these types of things, internal fat, a lot of the things that I've discussed sort of piecemeal in different videos on Instagram or YouTube, and I want to be able to really kind of discuss that comprehensively. Yeah. And then, the other things I do is breast and body, and so I want to talk about breast augmentation, breast lifts, when to use an implant, why I don't use implants. I mean, I think I may be a little bit more unusual in that setting, and then I'm kind of a little bit more particular as who I use an implant in. Okay. So, that's definitely something I want to discuss and people to understand. And, just the fact that not every single person is a candidate for every single procedure. And that's important to discuss, too.
Right. Well, that's really interesting. So we're going to be going from beginning to end.
Yes.
It's not just about the procedure, obviously. All the prep and information you'll need before and all the stuff after. So we're obviously going to do this in a fun way, though.
Yeah.
So I think we're going to kick it off with what is my favorite and will be your favorite part of every episode, and that's our wheel.
I love the wheel, too.
It's time for the wheel.
Let's do the wheel.
Let's do the wheel. Oh, it's coming.
If you know, you know.
All right, guys, say hello to the OG wheel.
Hey, look at that. That looks nice. I like that.
It looks amazing. It's official.
Look at the OG.
Wow.
What do we have on the wheel?
We have a few different things. I think the way we're going to do this with you guys is as we land on each different possibility, that's when we'll really explore it. But I think at a first glance, there's some TikTok action, maybe some questions. Ooh, dollar signs. It's my favorite symbol. Some money for you guys. Some other cool fact or myth.
Okay,
all right. Well,
do
you want to spin the wheel? Should I spin?
No,
the
you
wheel?
spin the wheel. Go ahead.
Right, here we go. Should I stretch maybe?
Yeah, I don't want you to pull a tricep over there.
You know. If you know, you know.
Oh, okay.
Fact or myth?
Fact or myth? It's arrived. It's arrived.
All right, let's see what we have.
Are you nervous? Are you intimidated?
No, I feel okay.
Okay, good. Here we go. Fact or myth?
As long as it's plastic surgery related.
Oh, I hope so.
Yeah.
All right. Fact or myth? Liposuction is a great tool for weight loss.
That is a myth.
Tell us more.
So, I mean, really, if that was true, then I probably would be pretty skinny. I mean,
I guess everyone would, right?
Yeah. So, no, liposuction is our most powerful tool that we have. I've said that so many times. It is amazing what we can do with liposuction in order to reshape the body, but it's not for weight loss. Your weight really doesn't change after liposuction. It's really specifically designed for removing, fat to change the shape of the body and not for weight loss. It's not an effective treatment for weight loss. So patients who have liposuction, we want them to be at a good, healthy weight.
Okay.
Before having lipo.
Interesting. Okay, so it's not people I think would see that as, let me throw money at it. This is a quick fix. Things aren't working. Let me just go do it this way.
Yeah.
But you still have to get to a healthy weight. And then what about maintaining that healthy weight once?
Yeah, it's
you
the
have
same
it?
thing, and that's why if patients have higher BMIs, for example, they're not good candidates because we don't want to do the liposuction and then have them gain weight again afterwards.
And could you tell us a little bit of what BMI means?
Yeah, BMIs, I think it's kind of something that's a little bit overrated, to be honest with you, because it's just body mass index. It's a way to try to, group people into, healthy versus non-healthy in terms of what their BMI is. So higher BMIs are unhealthy, lower BMIs are healthy. And it's just a ratio of, the weight to your height. But there's obviously huge differences between men and women. There's big difference between patients in terms of their muscles and things like that. So I use it as a general guideline. We have to have kind of a general guideline in order to help people screen people, basically, to say, no, your BMI is too high. You need to lose weight before you have plastic surgery. But there's so much variability with it because you can have somebody that has just a lot of weight in the lower part of their body. They have bigger legs, for example, and they still have very little internal fat and a relatively small waist, and makes them a good candidate.
Okay.
So it just depends a lot where patients store weight. So we'll be talking about that more in the during the season. But I have a lot more to say about it, but I don't want to go make this all about BMI.
Yeah, we'll say that for another episode that you guys have to tune into. So, well, thank you for clearing that up. Liposuction, not a weight loss tool. You got to stick to good nutrition and move your body a little bit every day, and that'll get you right there. Well, Dr. William, I'm so excited for this season.
Yeah,
all
I'm
the
really
topics
excited
we're
too.
going to cover. We're going to have fun. We're going to learn a lot and help you guys out and get you guys ready for your BBL or whatever surgery you're going to have. But until that first episode, guys, thanks for joining us, and we're so excited. And
thank you. I'm really excited too. Yeah, it's gonna be a great year. I'm really excited.
Don't forget to like and subscribe and tune in for that first episode, and we'll see you there.
You're about to experience
All right, thanks, Gabby.
Thank you, Dr. William.
Behind the Mask, the podcast. Behind the Mask. With Dr. William, the genius. Behind the mask, mask. The more you know, the better you do. Behind the Mask, the podcast.